Oftentimes, we as coalitions believe that if we're going to get systematic change, we're going to need to get higher. We're going to need to get to the C-suite. And with that, I think it's going to require a different mindset on how you communicate, what you communicate, even how you integrate your thinking into their way of thinking. Get it up there. And frankly, for many of us in the coalition world, we haven't really been exposed at that level. We aren't necessarily working with the C-suite. And I think what's incredibly important for us is to learn what's the secret to that. And the good thing about Darryl is he actually does that. He already does work with that.
I truly believe that CEOs can play a significant role in changing and fixing healthcare for their employees. Why is it that the employers, the customers of healthcare who buy the lion's share other than Uncle Sam, work for the healthcare system? There's got to be ways that we can get the healthcare system to work for the customer. No other industry does that. It's the only industry in America where the customer works for the vendor. So healthcare can be half the cost if we simply use the power of our spending money. Now, let's put that in perspective. For most companies, if you were to save half your healthcare spend, it's more than your current profits. It would more than double a company's profits if you were to cut your healthcare costs in half. You not only cut the cost, but how you make it a better benefit for your employees. And it's all about alignment, choice, and relationship, and we're going to talk about each of those today. So I get the chance as a speaker to CEOs to get in front of CEOs on a regular basis, and I love to ask them the question, why do you do it? Why do you buy healthcare for your employees? And after thinking about it for just a little bit, they say almost always the following four things in this order. I do it to attract and retain top talent. I do it because I want a healthy, productive workforce, because my product is better, my clients are happier when my employees are healthy and productive. I want employee satisfaction, and I wish it were more affordable. So I then ask, what are you measuring? And I ask you, what are you analyzing when it comes to data relative to your health benefit plan? And I would suggest that the most important data for you to analyze, you're not analyzing. And what is that? It's, are you actually accomplishing the very business objectives for why you buy healthcare? Very few employers in this country are actually measuring to see if they're accomplishing their business objectives. Are benefits actually working to attract and retain top talent? When you do, you'll be far more effective at reaching your objectives. It's not a difficult process to sit down with your CEO and simply, with the top executives of your company, decide why you're buying health benefits in the first place. That's not an arduous process. And it's the most important step we're not taking in healthcare. And it needs to be taken. We're going to talk today about how you need to, as the buyer of healthcare, make the healthcare system work for you. Are you aligning both your internal teams and your external teams to give you your business objectives? Very few employers are building incentives and bonuses into the HR, the benefit managers, and why not the whole workforce, compensation to accomplish the very business objectives for why they're purchasing healthcare in the first place. It is the biggest void in our industry. And then once you've aligned your internal teams to reach those business objectives, for goodness sakes, align your consultant who you're bringing in. The gold standard of employer-client relationship is not a broker letter of record. It is a fee-based contract. And simply having a fee-based contract is a mediocre step in the right direction. That contract needs to include incentives to help you, the company, reach your business objectives. If you don't start there, the entire healthcare system is going to keep working against you, and you're going to be working for the system. Now, right now, we're spending in this country, on average, $13,800 per employee per year. That's not the employee's portion of the premium. That's not the deductibles and copays. That's the employer's portion. Those consultants who have built this alignment into the way they work with employers are spending $2,000 to $7,000. Their clients are spending $2,000 to $7,000 per employee per year. That's less than half the cost of what everybody else is spending, because they're working for the client and they're thinking outside the box. Now, did anybody know that there actually is a healthcare system out there in the world that we can put on a pedestal and say, that's how healthcare should work? It's called the NUCA system of care, and it's up in Alaska. Globally recognized as the best healthcare system in the world, the only healthcare system to win the President's Malcolm Baldrige Award twice. Their outcomes and satisfaction levels are bar none better than any other healthcare system in the world. Countries from all over the world travel to Alaska to figure out how in the world can you do healthcare so well with so incredible population health improvement and do it for half the price. And you ask, okay, how do they do it? They actually built healthcare around the customer. I can say this because I used to run hospitals. In the healthcare industry, it's all about we're the holy institution of medicine, where all the wisdom lies. Come be the benefactors of our great wisdom, and we'll make lots of money fixing you when you fall off a cliff. Healthcare is not built around the customer. NUCA system is one of the only ones who actually went out to their customer before they built their system and spent enormous amounts of money and time asking their 65,000 Alaskan Native people, what is it that you want from your healthcare system? And they said, we don't want a paternalistic system that tells us what to do. We don't want a hospital at the bottom of the cliff only. And we don't just want fences at the top of the cliff. We want a healthcare system that journeys with us on our path through life to help us live life to its fullest. And the NUCA system had the tenacity to build a system around that concept. Revolutionary? Absolutely. It's not how healthcare works today. But you can accomplish what they accomplished. Now, how do they do it? Well, first of all, they built a relationship-based healthcare system around the customer. I'm going to say that word again, relationship. We're going to come back to that a few times. Relationship trumps science. That doesn't mean the science is not important. But when it comes to managing healthcare, there's nothing more important than relationship. And the NUCA system figured that out and made that the priority. So they built this massively powerful primary care system that was based on relationships. They said to this team of doctors, nurse, case manager, you're going to be assigned these people, and your first priority is not to simply fix them when they break. Your first priority is to reach out and through storytelling, I love that term that they use, get to know every single member in your population. And be an influencer, a coach in supporting them to live life to its fullest. That's your first primary job. And when they need health care, when they need your services, you already know them, they already know you, they have their phone number, you give them immediate access to health care. And you coordinate all their care at all the different levels. And all the different care levels come to the patient. It's not about sending patients to all these specialists and all these different appointments. They come to the patient because healthcare is built around the customer. They call it an aspirational healthcare model. Not a deficit-based reactive sick care system, an aspirational system. So it's not just about building hospitals at the bottom. It's not just about putting fences at the top. It's about journeying with people to help them live life to its fullest so they can actually reach their destinations and their aspirations. So can you, employers, do that? Absolutely. That's my job today, is to show you how employers can do that. You don't have to go build hospitals to do this. It's all about how you spend your money. And think about this aspirational model of healthcare is going to be far better at attracting and retaining top talent, which is your number one, in most cases, objective. It's going to be far better at actually proactively addressing emotional, mental health needs. It's going to be far better at proactively addressing physical needs. And it's going to be a lot better at increasing employee satisfaction. And it's going to cost about half as much. There's 4 strategies we're going to talk today about how you implement an aspirational healthcare benefit for your employees.